So, Dr. Smith, can you please tell me about body dysmorphic syndrome?
Yeah, body dysmorphic syndrome. That's actually more common than you would think, but it is people who are like the anorexic person. Anorexic person looks at themselves, they weigh 90 pounds, and they think they're fat. Body dysmorphic syndrome is the same thing. When people look at certain areas of their body and they fixate on those areas of their body. They may choose their nose, and they think their nose is just so horrible, and it's a normal nose. It's so horrible they can't even go out in public. And if they get off that fixation, then they move to another one. But there is always something. They are never done fixating on something. And it is a psychological disorder. It is not a disorder treated by plastic surgery.
And so they're never happy with themselves, no matter what they do.
No matter what happens.
And they seem to try to treat that by seeing surgeons. And so what do the surgeons do?
You know, a smart surgeon doesn't operate on them, okay? But even the smartest surgeons can be fooled. I have been fooled. I have one patient with body dysmorphic syndrome, and honestly, she makes my life miserable. She comes in, she demands more and more and more surgery, and is never satisfied, and you're always trying to say, you know, surgery is not the treatment. It is important that a surgeon be able to pick this out, and we are trained to pick that out, but occasionally we're fooled. Patients learn too. They go to 3 or 4 surgeons and they learn, oh, I can't say this, I can't say that. You know, they get better and better, and then they come to the 4th or 5th guy and they know exactly what not to say. You know, oh, I don't care that much about it. I mean, just like it a little nicer. You know, they learn to say some things that will fool you. And once you get sucked in, it's a very difficult thing. But we know many famous people with that. And, you know, a perfect example of that would be Michael Jackson, right? Mm-hmm. Michael Jackson was never happy. His nose had to be narrower and narrower, and his chin wider, and more and more and more plastic. He was never happy with himself, unfortunately. And that is a perfect example of body dysmorphic syndrome. And it is not treated with plastic surgery.
And so really it's an addiction, and to get their fix, per se, they know what to say to you. But now, do you get in a position where you're actually, in a way, afraid to turn them away because you're afraid that they'll go to somebody who might hurt them?
You try to educate them, you know, and I've tried with my one patient who really has it, to sit them down and say, look, you know, you look fine, everything is great. It is not worth, you know, another surgery. This will not really improve, or this doesn't really need to be done. You do try to educate them. I'm not afraid that they'll go to another surgeon. We do our best to educate them, and then hope that they will, you know, go to a psychiatrist. That's the person who should treat them. My dad, the psychiatrist, as a matter of fact, or another psychiatrist. My dad is a psychiatrist. But it is not treated by plastic surgery. Unfortunately, we as surgeons do get fooled.
Well, thank you for that information. We appreciate it.
Thank you for coming and talking to me. It's always nice to visit with you.